I've had braces for over 1 year. I got them in July last year, so about 1.5 years. And before I had braces, the teeth just kind of sat straight on top of each other like this, so I could chew stuff because if they connect then the food like gets in between and it breaks. But as the braces straighten the teeth, they like straighten them according to where your jaws are. My lower jaw is larger than the average and my upper jaw is shorter than the average, so the jaws are like this. When you don't have braces, your teeth just kind of arrange themselves so that they can like let you eat and chew food and stuff, but braces straighten them according to the position of them, and so I have uneven jaws, so the teeth were like this, and when they got straight they went like this. So then when I chew, the food doesn't actually like get cut properly, so I can only like chew food and break it up at the very back at the sides, which is fine because you usually don't chew it and cut it at the front, but except for when you're eating sandwiches and burgers and all those bread things that you bite into, or like an apple or something. I hate apples, but apple, you know. And so it just doesn't work. And you can tell from when I do that, it's just there, like yeah. I can put my whole pinky in there too, which is pretty, you know. And I can stick my tongue through there, like. Really bad, and it's easy to just sort of think, oh yeah, it would be annoying but it's not that bad, you can still eat food. And I'm like, yes, but when eating is one of the prime functions of a human, and eating should be one of the easiest things you can do, it gets a bit annoying, and it's, if you have the chance to change it and fix it, why would you not take it, like, you know. And it also affects how well I breathe and how I speak. I have a bit of a slight little lisp because of it, I assume. And I dribble a lot. Like, I can't help it, but it just, if I'm concentrating on something, I might just dribble. It's not very nice. Also, I've taught myself to breathe through my nose, but generally breathing through my mouth is a lot easier. And I think when I'm asleep and unconscious, I breathe through my mouth. And because it's, yeah, and it's hard because I have to manually close my lips as well, like they don't just fall shut, because if the lips aren't aligned they're gonna have to sort of, especially when there's braces along the bottom, and the lip's already like far away from the top lip, it has to bend around the braces and to connect with the top lip. And so sometimes when I'm, you know, in public, I don't want to like breathe through my nose but let my mouth hang open like it naturally would, because that looks a bit like, I don't know, a bit stupid or something. It hangs out quite a bit too, so it, you know, I'd be worried I'd dribble as well. But yeah, and so sometimes when I'm holding my mouth shut, it starts shaking or trembling or something, and it's really uncomfortable. And then sometimes with my jaw placement, I forget where the actual natural positioning of them is. So like when I relax with my mouth just like and let it hang, my teeth are like connected at the back, but sometimes I think, is it more comfortable if they're not connected at the back, if the jaws are actually like open and relaxed like that? I don't know, it's not there's no certain position for anything. It's a bit weird. Yes. And I also have noticed in the recent months, closer and closer to my surgery, it's harder for me to eat with my mouth closed, because I feel like, you can imagine if your jaw's just like really big and you have to manually close your lips as well. Like if you're trying to eat with your mouth closed and you can only chew stuff at the back, it's like it's a lot, feels like a lot to fit in when you do it. And so a lot of the time at home I just chew with my mouth open, because it's honestly so much harder to close. There are many variations of jaw problems and abnormal positioning and everything else. You can have an underbite where the lower jaw is longer than the upper jaw, and so, you know, under is bigger, so underbite, or overbite where the lower jaw is receding and the upper jaw might be a bit bigger than normal. I'm not really sure if that happens, but in some cases with underbites, it's just the lower jaw that's long and the upper jaw is just fine, but because my upper jaw is a bit shorter than normal and longer, they don't want to like adjust just the lower jaw to fit with the top jaw if that's already small, because then I'm not sure, like it's just too much to remove and it might not fit back, and then my face will just be really flat. Oh, I'm not really sure. So what I'm actually going to get to fix it is pretty major. Instead of like moving the whole lower jaw back, they're gonna bring it forward so they kind of 50-50 both move a little bit, so it's more even and everything else. And so what they do is they sever the jawbone. It doesn't affect the joint at all. They cut it somewhere along there. They take the chunk out and then they connect the pieces of jaw together again with special metal plates and screws that are permanent. And then with the upper jaw, it's the same thing, just the other way. They cut the jaw somewhere along there, and then they push it out, and then they just set that in place with plates and screws as well. Also, because my jaw is sort of lopsided, because like you can kind of see, I'll come closer. Also, my teeth are really not white because I drink a lot of tea, and so over the years they kind of get stained, but you can see that the middle and the middle don't align straight. This is sort of to this side, so the whole jaw has to be shifted. So maybe it'd be a bigger bit taken out of this side and a smaller bit taken out of this side. From that, I'm expecting like change in not just below my top lip, but like up to my nose, and it's usually the nose tilts up a bit more, which I'm fine with because I think that looks kind of nice. But I mean, I don't have a problem with my nose at all at the moment either, but at least I don't have to worry about the change there because I don't mind it. But some people might not like that, and then they have to specialise the surgery to minimise that if the patient's worried about it, but that's not a problem for me. As well as all that, I am getting all 4 wisdom teeth removed. So, except I hear that the recovery from jaw surgery, particularly double jaw surgery, is nothing in comparison to just wisdom teeth removal. Because you can imagine, like, there's no, like, the teeth, like an incision is made and the teeth come out, but it's nothing like the bone being shortened or lengthened or having stuff screwed in there. Or anything like that, so it's very different, and the puffiness and the swelling is going to be so much worse, but it's okay. It's just going to be weird because I've never broken a bone or anything or had any sort of swelling for anything ever, but that doesn't matter. It's just going to be a life-changing thing, and because it's such a common surgery, it's easy for people to just sort of write it off as nothing major, but really your face is, anything to do with your face is pretty major because that's what everyone sees, and that's where most function is, like sight, smell, hearing, taste, eating, everything, breathing. Yeah, so I'm really excited for that, but having to just eat soft foods and liquids for the first 2-3 weeks, it's gonna be really tiring, and it's a good thing I like soft food. I like custard, I like jelly, I like soup. You know, that's just lucky. But I don't think I will like it after my surgery. But it doesn't matter. One thing I do always want to make sure people know, though, it's not cosmetic surgery. It's only cosmetic if your functioning is fine and you're just purely doing it to like make your face look better. But no, in my case and in most cases that's just what comes, which is good, which is another reason why it's good to get it. But I mean, it's not priority by any means at all. So I'll just show you exactly from all angles my jaw so you can get a good feel of it. So this is from the front. and here's my teeth. And if I look down, you can see the gap, and you can see how it's not an even gap either, it's slightly tilted, yeah. Yeah, there you go. It's pretty big. And to the side. There you go. And you can also see how my lips kind of don't look comfortable, because they're not comfortable at all. They're just kind of, I'm holding them there. Sometimes it does feel worse than other times though, and right now it just sort of feels normal, but for an extended period of time it gets really, really uncomfortable. But anyway, here's my underbite teeth. There you go. That's another thing. Also, when I yawn, or even if I go to the dentist where, you know, your mouth opens wide, my jaws click too, which is really kind of scary, because I'm scared that one day they're going to just stay there and I won't be able to like unlock it, lock jaw problems. It's never done that before, but that's always a problem that I worry about. And there's a possibility that the jaw surgery will fix that, but it might not. But I don't know. I mean, I don't really see how it would change that, because it's the joint that's doing that, and the surgery doesn't affect the joint. But it could somehow fix it, which would be great. But it's just something else that's annoying. But yeah, there. Then from the other side. It'll be great. I just look forward to it so much. Been waiting for this day for a long time. I'm a bit scared, but I know that after the first week, it should be relatively fine. And for me, in a week exactly, it'll be Christmas. So that'll be, what a great Christmas. I think of it as a Christmas present though, honestly. Like, I'm just so happy that I have the chance to have this surgery and fix this problem that is life-changing, really. Because if you don't fix it, like my dad, I got this jaw problem from my dad, and he didn't have braces, and he didn't have surgery, and he didn't have anything, and his teeth are really crooked, but they're not too bad, and his jaw's big, but it's not as big as mine. But he does like bite his tongue a lot and stuff, and I don't know about him, but I've been told that if you don't have the surgery and fix it all up, it's quite likely that you'll get arthritis in the jaw when you get older. And I thought that sounded just so bad. I was like, no. The reason why I'm doing this video is because I watched a video, or a few videos, and I found them really, really helpful, and they just like gave me a lot of insight into what to expect and stuff, although I still don't really know. But I mean, of course, who knows? Everyone's sort of experience is different, and everyone's case is different. But hopefully this can like help others. I usually wouldn't speak into a camera, but I feel like there's a possibility that the surgery will affect how my speech sounds, because it kind of, if you haven't noticed already, I feel like it gets a lot of saliva and like really cloudy and kind of unclear, and I get breathless as well. I don't know if that's to do with the jaw, but if I can breathe easier with the jaw surgery, I assume I'll be able to speak better, and that would be really helpful, because I'm going to have to, when school goes back at the end of these holidays, I'm going to have to do a speech. And one of the reasons why I freak out so much about public speaking is the fact that I find it really hard physically to actually do it, and I get really breathless and really nervous, and I don't like public speaking, and this would just help me a lot. And also I feel like if I look better, obviously if you look better you feel more confident, so it'll just be all good, and it'll be just great. So yeah, looking forward to it.